Good afternoon, everyone. Thanks for joining me this afternoon. As summer kicks into full swing, I know we are all coming and going with visits to see family, trips to the beach, fun vacations, and more. But one group that doesn't get a break like that is children in crisis at the Department of Social Services. Today, we'll be talking about a growing problem in Aiken County, children needing foster parents. In some cases, parents have problems with substance abuse, mental illness, domestic violence, and a lack of parenting skills. All of these children have experienced trauma and need support to help them heal. Samantha Bryant-Hart will join me in a few minutes to discuss the need for foster parents right here in the CSRA. Also, a local music production group, Ragz2Richez Recordz, is looking to change the course of young lives through music. Joe Curry, Lorenzo Griffin, and Sounds Great will be here shortly. But first, New York Times bestselling author Mary Alice Monroe is coming to the Garden City next week as part of the Augusta Author Series Luncheon, presented by realtor Kelly Brands. The award-winning writer will be discussing her new novel, Beach House for Rent. That's the final book in the Beach House series. It's coming up next Tuesday, June 27th at Abel Brown's Southern Kitchen and Oyster Bar in Surrey Center. Doors open at 11:30. A three-course lunch will be served. The bar will feature specialty cocktails and drinks, and also some nice wines. Tickets are limited and can be purchased online. The price is $62, which includes lunch and a signed book, and lunch with no book is $36. And don't go away. We'll be back with a discussion about the tremendous need for foster parents in Aiken County and ways you can help after the break.
Well, you don't know.
Welcome back, everyone. In South Carolina right now, there are more than 4,200 children in foster care, but unfortunately, 58% of those children have to be placed outside their home counties. That separates them from their schools, their churches, their friends, and their support systems. In Aiken County, some 70 children are in foster care, but there are only 42 licensed foster homes. Would you consider fostering? This is a youth formerly in foster care who says, "We need your love and concern to heal and to truly feel like part of the family. Show us trust so that we can learn to trust you." That's an important thing that happens in foster homes. Deborah McKnight is a foster parent in Florence County. She says, "I think about what this child can become. Don't think of the negative situation they came from. Think of the future and that chance for you to give them love and guidance and care." Samantha Bryant-Hart is a human service specialist from Aiken's office of the DSS office, I should say. And Samantha, you're here to talk to us about the importance of fostering today. And it's something you've been doing for a couple of years, placing foster children in families. Is that right?
That's right. I've been placing children for about 2 years now and working with foster families in Aiken County.
You have a push going on right now with the Department of Social Services to increase families. And what are some of the things that you're doing to help reach those numbers?
We're reaching out to the local communities. We're looking for foster parents. We're speaking in churches. We're going to schools. We've done a lot of different things to just reach out to the community and ask people and talk to people about the need for foster parents in Aiken County. And right now in Aiken County, we have actually 79, as of June 1st, we have 79 children in regular foster care and only 41 homes to meet their needs. So that means 49% of children in regular foster care are placed outside of Aiken County. And so we really need an additional 38 more foster homes in order to meet the needs of all children and have at least one home for every child in foster care.
You know, people may think that's a great idea, I'd like to do it. What are the steps that people have to take to become a foster parent?
Well, they can certainly go on our website.
You have a lot of information there.
Yes, a lot of information on scfamilies.org. And they can look at the whole licensing process and also start the application process online. They can also call Heartfelt Calling 888-828-3555 and start the application process that way. Once they start the application process, they're going to be scheduled fingerprints, they're going to be scheduled for the initial training, their they'll go ahead and meet with a licensing coordinator, an initial licensing coordinator, and then they'll start the application process with them. They'll do the background checks, and then the family will go and do their medicals, and then they'll start the home study process with them as well.
Some people may wonder, can I keep my job? Will I be able to still work if I'm a foster parent?
Yes, they definitely can keep their job, and we want to make sure that they do have the income to support their family and also the foster child as they come into the home. So we definitely wouldn't want them to give up their job just to foster. And also we have childcare available. We have the ABC voucher program,
right,
and foster parents who are working qualify based on the child's income that's placed in their home. So if both foster parents in the home are working, or if one foster parent is working and one foster parent is disabled, so the other foster parent's taking care of that person, they automatically qualify for the ABC voucher based on the child's income.
Okay. Is there any other kind of financial support for the children that are in the system and the foster families?
And each child, they're going to receive a board payment for that child to help them meet that child's needs.
Okay.
And the board payments range according to the child's age.
That makes a lot of sense. Is there particular training that's necessary to be a foster parent?
Yes, they're going to do 14 hours of initial training, just basically to introduce them to what foster care is, how they're going to best meet that child's needs, and just kind of walk them through being a foster parent. And that's basically usually takes place on 2 Saturdays. So 7 hours on one Saturday and 7 hours on another Saturday.
Okay.
And that's just the initial training. And then during the 2-year licensing period, so they're going to get licensed for a 2-year period. And then during that 2-year period, they're going to do follow-up training. Each foster parent is going to do 28 hours of continuing education in order to get new information to the foster parents about, they can do CPR, they can do first aid, or they can do trauma-related training so they can learn more about how trauma impacts children and things like that.
You know, speaking of the children, a lot of these children have come from volatile situations, abusive situations, and I think probably one of the biggest problems is drugs and the opioid crisis. Talk a little bit about, you know, what place these children are coming from who end up in foster care.
Okay. Every child comes from a different situation, and every child is different. So children are coming from environments where the housing conditions aren't appropriate, so they don't have enough food, or they don't have water, or they don't have electricity. A lot of the cases that we deal with are neglect. So, and a lot of it, you're right on when you say drugs has a huge impact, whether we're dealing with domestic violence or neglect, housing conditions, whatever it is. A lot of the times drugs are involved. So it's just, they're coming from all different environments though.
Right.
Sometimes abusive, but a lot of the times neglect.
Is the foster parent aware of that child's background? How much do they know?
We're going to give the foster parent as much information as we can so that they can best meet that child's needs. So anything related to the foster parent being able to meet the child's needs, we're going to give them that information. So in other words, they're going to need to know if there's domestic violence and that child has been a witness to domestic violence, they're going to need to know that so that they can get the child counseling to deal with having witnessed that domestic violence in their home.
I was going to ask about that, and you answered it for me. There are more than just the foster parents involved in helping to, I don't want to say rehabilitate, but helping to heal that child. There are other systems like counselors involved.
That's right. They're going to be involved with the caseworker, with us as the family support coordinators, and then there's counselors, medical providers, the Child Advocacy Center for forensic interviews. There's a lot of resources within the community to help meet that child's needs.
Okay. Okay. What happens then if it's a very successful matchup and that foster parent wants to adopt the child?
Well, our goal is, of course, always reunification with their family. So, of course, always we're going to pursue keeping that family together and bring the child back to their biological family. But if that's not if we're not able to do that and the child becomes legally free for adoption, a lot of times the foster family is going to adopt the child. If the foster family wants to adopt the child, and also they can best meet that child's needs. So in other words, if the child is placed in their home but they also have siblings, we would first, of course, want the siblings to be adopted together.
Right.
So it always depends. I'm not going to say, of course they can adopt the child.
Each situation's different.
Yeah, every situation's going to be different, and it's always going to be child focused. So whatever's in the best interest of that child is what we're going to try to pursue.
Have you witnessed just really good outcomes in the time you've been doing this with fostering?
Definitely. Whether the foster family is able to connect with the biological family and be an awesome role model for them and see that child.
So that can happen. The foster family can eventually meet the birth parents and all.
It does happen, and a lot of times it works out really awesome for both the foster family, the biological family, and the child. So when they're able to work together to meet that child's needs, that's really what we want to see happen. And sometimes it doesn't happen like that. Sometimes the child just really connects with the foster family, and the biological family isn't able to do what they need to do to get that child back into their home, and the foster family is able to adopt the child. But we have really great outcomes all the time. We see really awesome things happening with the foster family.
Now, one of the things that you will see when you go to the website, and all the information will be on the JENNIE page on our website, WJBF.com. You can find it there. But you see the children who are in regular foster care, and then some that are special needs foster care. How do you differentiate that? And is there additional, families might not be matched with a special needs child if they aren't equipped for that?
That's correct. The children that are considered special needs, they're going to meet a certain criteria to be considered special needs, whether it be based on their mental health needs or their physical needs. It just depends on the child. And then families are licensed through private agencies as therapeutic foster care providers, and there's different levels of therapeutic foster care providers, and depending on the child's needs, they're going to be placed in a different level of care. But basically, they're going to have a lot more training in order to meet that child's needs, and they're going to be reimbursed differently. So they're going to receive a different board payment, and they're going to be required to have more documentation. So when they're giving that child their medication, everything like that, there's just a lot more to it. There's more training, there's more documentation, there's more traveling and things like that to different medical providers or mental health providers.
All right. Well, Samantha, you have given us such important information, and again, just think about it. About half the children in Aiken County who need foster homes have to go elsewhere. So if this is something that's been on your heart, look up the information and figure out how to make it a reality. And Samantha will be there, and other staff, to guide you through. Thanks again for your time.
Thank you.
We'll be right back.